Local healthcare officials and lawmakers claim that changes to the proposed One Big Beautiful bill could have negative effects on healthcare in the area if passed. The bill, though, is currently in limbo after the Senate parliamentarian alerted Congress today that part of the bill does not follow procedural rules. News 5's Liam Bridgman joins us live in studio with details on what Ballot Health said to their employees about the potential cuts. Liam.
That's right, Casey. This bill has continued to be a back and forth battle between Republicans and Democrats working to address several concerns. One of those that we've continued to follow closely is changes to the Medicaid provider tax, which, according to health officials and lawmakers, could have major consequences for our region if passed. The proposed bill Senate Republicans are pushing would change the Medicaid provider tax. This tax provides states with additional revenue from Medicaid to help fund hospitals like those in our region. In an email sent to Ballot Health employees by the system's CEO, Alan Levine, the changes to the bill's language would cost Ballot nearly $200 million if passed and, quote, lead to catastrophic failure of rural hospitals and hospitals throughout Tennessee and Virginia, end quote. Virginia Senator Mark Warner echoing this message.
This is an awful bill. I will vote against it in every fashion and form. And it will be devastating, not just to Southwest Virginia, but Northeast Tennessee as well.
According to Ballot, Senate reductions would cause Tennessee hospitals to face a $320 million funding cut in their first year alone, and for Virginia hospitals, an estimated $2 billion. Virginia Senator Tim Kaine says he's doing what he can to make sure these changes don't move forward.
My main goals going into this are dramatically curtail the negative effects this has on people's health care, Medicaid and other provisions.
This is a disaster. We've dramatically brought down the number of uninsured in Southwest Virginia. It will skyrocket again with closure of rural hospitals and lack of available services.
In his message to employees, Levine acknowledged the ongoing effort by lawmakers to stop these changes. Quote, we are fortunate that our U.S. senators in Tennessee and Virginia understand this, and they have all consistently supported us, end quote. I reached out to Representative Morgan Griffith. He didn't want to comment until the Senate's final revisions were made, but he has made it clear he'd like to see the Senate bill align more closely with the House version, which freezes the Medicaid provider tax rate. This is an ongoing situation. I originally had an interview set with Ballot CEO Alan Levine, but the new developments today, he says he needs more information on the proposed changes. We'll bring you the latest updates when the Senate finalizes their version of the bill. Now, an exact timeline for that does remain uncertain, but Senator Kaine did mention the Senate would likely debate these changes throughout the weekend.
Liam, thank you very much.